Welcome to Beyond the Scar, the podcast that empowers you to navigate life after a C-section with confidence, strength, and grace. I'm your host, Nicole Alfred. And as a mom who's been through it all, I'm here to share stories, strategies, and support to help you thrive beyond your scar. So let's dive in. So today we are addressing a topic that often is whispered about, but deeply felt by so many moms. And I know I felt this too before. And it's postpartum anxiety. So if you've ever felt like an overwhelming worry, a fear, or persistent sense that something isn't right after giving birth, you're not alone. Postpartum anxiety affects more moms than you think, and it's not a reflection of the love that you have for your baby or the strength that you have as a mom. In this episode, I'll unpack common symptoms of postpartum anxiety and how it can impact your recovery and daily life, and the strategies that I have to manage and heal. And of course, at any point, if you are worried about your mental health, please reach out to a mental health practitioner or your doctor or go to the hospital. So let's talk about the difference of postpartum anxiety versus normal new mom worries. Because, being a new mom, you're going to worry about everything because you've never done this job before. So, this is a very common and treatable condition that can include persistent and excessive worries, feelings of tension, and inability to relax. So, postpartum anxiety can be triggered by hormonal changes, real stressors. Like I went through this during COVID because my second was born a couple of days into COVID. These like life stressors were happening around me. My husband also lost his job. Like there was so much things happening around me. And if you have a history of anxiety or even pregnancy loss, can be a big one. Symptoms can include panic attacks, which are episodes of intense anxiety with physical symptoms like racing heart, shortness of breath, and dizziness. And then new mom worries are, something that many new moms experience. And this give you feelings of like sadness, worry, tiredness, because you're completely exhausted in those first 6 weeks, which sometimes is called the baby blues, if you've ever heard that term. And these feelings are usually mild and go away after a couple of weeks. Postpartum anxiety and postpartum depression can share some of the symptoms like difficulty sleeping, irritability. However, postpartum depression involves feelings of hopelessness and sadness that just don't go away after 2 weeks or that make it really hard for you to care for your new baby. So, symptoms like racing thoughts, physical tension, insomnia, constant fear something bad's going to happen. The impact on your recovery will affect your physical healing, and it can be slowed by the stress because maybe you're too afraid to do the wrong thing, or you're just not even like moving your body enough. And it will affect also the bonding that you have with your baby. It might feel much harder. So, one of the key steps to addressing postpartum anxiety is first, acknowledge it. Too often, moms feel they need to be, toughing it out. But the truth is, seeking help is a sign of strength. So, some of the ways that I know I've dealt with the postpartum anxiety when I had my second, and then I've talked with other moms about, one of them is breathing, deep belly breathing to calm your nervous system. The benefit of deep belly breathing is that you have to actually think about the breath. You can't just, it's not just automatically happening as you're moving, right? We just automatically breathe. But when you do the deep intentional breath, you have to actually think about it. And because you're thinking about doing that deep intentional breath, you're actually not even thinking about your stress or worry that you just had. So not only is it good for breaking that mental thought pattern, but it's also really good for your nervous system, brings more oxygen to your brain, and can be very calming. There's also some grounding exercises. So the five senses exercise. So identifying something that you can see, that you can hear, that you can touch, that you can smell. So that could be, holding on to an object that has a feeling to it. Maybe it has a smell and you can smell it. Again, these things are going to kind of stop those anxious thoughts from happening because now it's bringing your attention to the stimulus of whatever you're holding. Journaling can be a huge one. I know this really, really helped me. I love buying journals that are like really pretty. And then what I do is I just kind of jot down how I'm feeling inside. This can be really helpful for you to get the thoughts out of your head, especially if you're not comfortable sharing them with others or think that you can relate to others. It just gets it out of your body, and maybe you can even read it and reflect on it. And then really see how much you are suffering mentally or not. And externalizing your thoughts will help you reduce the intensity of how you're feeling. And then seeking professional help, emphasizing the importance of Seeking a mental health practitioner or counselor if your anxiety feels overwhelming and you just can't live your life, you can't do every day. Even if you're just crying all the time, some of this can also be from PTSD, post traumatic stress disorder, and it can go hand in hand with the anxiety because if you had an emergency cesarean or the recovery has been more difficult than you anticipated, it can be a really, really stressful time. So make sure that you seek mental health practitioner help if you really can't move through it with these simple strategies. So, beyond professional help, there are daily practices that can help manage your postpartum anxiety and nurture your mental health. Some of the things that we do in our program, the C section recovery method, do actually touch upon these things. And this is why we've had clients have such huge success with working with us in the program. Scar massage, body awareness. So, this is going to help you reconnect to your body and it's going to reduce the physical tension in either your body or even your scar tissue. So, like connecting back to how you gave birth and connecting back to your body is almost like a grounding technique, but it really does help you connect to your physical self and not just always staying in the mental space all the time. Movement, knowing exactly what movements to focus on, like gentle stretches or short walks, or even the movements that we have in our program, like squatting. These are going to help give you a sense of control over yourself because you're able to see, okay, I can properly move my body in these ways. And now my body feels a lot more capable and a lot easier to move instead of there always being pain with everything I'm doing or at the end of the day. This is gonna give you that control feeling, and also, like, going for short walks, getting out in nature, getting some movement in your body is gonna help boost your mood, release endorphins, and increase circulation and lymphatic flow, which is really, really helpful in recovery. And then mindfulness practices like guided meditations, doing affirmations in the mirror. These short little self-care rituals will help ground you and help you to just create another chain of thought pattern instead of kind of always thinking, I failed, I failed my baby, my body failed. Maybe you're focusing on affirmations and doing some mirror work, looking at yourself in the eyes and saying the affirmations to help actually boost your confidence and boost your self esteem again that you are capable and that your body is capable. Having a support system is so important to be able to lean on your community and your partner. People that work with us in the program, we have a community of moms. I'm in there. I've been there too. I know exactly what you're feeling. And we're all chatting and talking and leaning on each other for support because motherhood is hard and it can be very isolating and very lonely if you've never had these experiences before to know how to actually channel them. And last but not least, most importantly, have grace and compassion for yourself. This is a very difficult phase of life. It is the most rewarding, the most beautiful experiences are going to come from being a mother, but it is the hardest. And it's okay to have days where you don't feel amazing, where you feel like you're not okay. It doesn't mean every day has to be that way. And to all the amazing moms listening today, remember you are not alone in this journey. Postpartum anxiety is not a reflection of the love you have for your baby or your abilities as a mom. It's something that many of us face, and there are so many ways to heal and thrive through it. If you're ready to take the next step in your recovery journey, I encourage you to book a free 15-minute assessment call with me. Let's work together to build a recovery plan tailored just for you. And if you found today's episode helpful, please follow us, leave a review, and share this episode with another mom who might need to hear it. Together, we can reach more moms and create a community of strength and support. Take care.